Good afternoon, dear patients. Today we are going to talk about a case of discharge in a man with Ureaplasma Urealyticum. A man came to us with purulent discharge like the one you can see in the picture. Accordingly, he hasn't had sexual intercourse for quite a long time, about 6 months, but recently he had acute respiratory infections and as a result came to our clinic with this kind of discharge. Regarding the acute respiratory infection, he only took anti-inflammatory and antiviral medications. So he suspected it might be his kidneys or something else. To begin with, tests for sexually transmitted infections were taken and only Ureaplasma Urealyticum was detected. Accordingly, about a year ago, he self-medicated after reading about it on the internet, using one of the antibiotics, specifically Josamycin or Vilprafen. He took it on his own, and after getting tests done at in vitro beforehand, he felt reassured and left it at that. At that time, he had no active symptoms, but now he was experiencing similar symptoms. We also took cultures naturally for bacteria. We did general urine tests, but in these tests, aside from Ureaplasma Urealyticum, there were no other pathogens. Accordingly, cultures were taken for Ureaplasma Urealyticum and also for the antibiotics many patients prefer, namely Erythromycin, Josamycin, tetracycline, and Doxycycline. This Ureaplasma turned out to be resistant. That's why all these calculations on the internet and so on often lead patients to the chronic progression of the condition. And often such patients come to me already having developed prostatitis as a result of either self-medicating with pills or taking medications prescribed by various doctors who basically just want to prescribe a bunch of pills and push the patient out of their office. Accordingly, in this particular patient, there was sensitivity to Ureaplasma Urealyticum. Well, actually, Ureaplasma species is determined, which is the sum of these Ureaplasmas. You can watch a separate video about this on our channel. What is a culture test for Ureaplasma? Accordingly, there was sensitivity specifically to Clindamycin, so antibiotics to which there was sensitivity were prescribed, including Clindamycin. Enzyme preparations like Longidaza, immune medications, and urethral instillations were also prescribed, as a result of which these discharges resolved fairly quickly. After the appropriate period, follow-up tests were taken, and accordingly at that point no leukocytosis, no discharges, and no ureaplasma were detected. This shows that many people believe that conditionally pathogenic microorganisms are harmless to the body. However, when immunity is lowered, as in this particular case, they take on a rather dominant role and accordingly become uropathogens. Personally, I believe that one should not wait for such moments in life. It is better not to have these conditionally pathogenic microorganisms in your reproductive system, or rather in your genitourinary system. And that is why, in principle, I recommend treatment for these infections. And of course, before treatment, it is necessary to undergo a proper examination, which includes, for example, culturing for ureaplasma in the case of ureaplasma and so on, as well as comprehensive appropriate treatment. And if you need diagnosis and treatment for any discharges, including those caused by ureaplasma or for the treatment of ureaplasma itself, you can consult the venereologists, urologists, and gynecologists at our paid KVD medical center in Moscow. We have qualified specialists who are experienced in diagnosing and treating such conditions. And finally, I'd like to mention that recently we had a case where ureaplasma was found in the mouth, and once again, doctors had independently prescribed Doxycycline and Vilprafen. This turned out to be ineffective. The patient came to us with a recurrence for the 3rd time, and accordingly, it was only when comprehensive treatment was prescribed that the ureaplasma was completely eliminated from the mouth. That's why you shouldn't take a careless, pill-only approach to treatment.